Through the African Union mechanism, Guyana is set to receive an additional 150,000 doses of the Johnson & Johnson vaccines to boost its immunization response to the virus. Minister of Health Dr. Frank Anthony on Monday during his COVID-19 update highlighted that government has paid a down payment for the vaccines which are expected to arrive in June.
And through that partnership, the African Union is making 1.5 million doses of vaccines to the Caribbean. And of that set, Guyana is going to get approximately 150,000 doses. And last week we made a down payment on those doses. So we are hopeful that during June that we'll be able to get those vaccines.
A sum of $7.5 million was paid to secure the vaccines. Unlike Sinopharm, AstraZeneca, and Sputnik vaccines, the Johnson & Johnson jab is administered as a single dose. It was 85% effective in stopping severe illness from COVID-19 in trials. In April, following reports of rare blood clots, the United States, South Africa, and the European Union health authorities had suspended the jab. However, following investigations, the United States Centers for Disease Control and Prevention and the Food and Drug Administration recommended that the use of Johnson & Johnson vaccine resume in the United States after a temporary pause. According to the CDC, reports of adverse events following the use of the Johnson & Johnson vaccine suggest an increased risk of a rare adverse event called thrombosis. Nearly all reports of this condition, which involves blood clots with low platelets, have been in adult women younger than 50 years old. A review of all available data at this time shows that the Johnson & Johnson COVID-19 vaccine's known and potential benefits outweigh its known and potential risks. The CDC further advises that women younger than 50 years old especially should be aware of the rare but increased risk of this adverse event and that there are other COVID-19 vaccine options available for which this risk has not been seen. General side effects of this vaccine include headache, feeling very tired, muscle aches, nausea, and fever. Guyana's mass immunization campaign continues to reap success despite vaccine shortages currently being faced by health authorities. As of Sunday, 198,956 persons had received the first doses of the vaccines. Fully vaccinated persons amount to 68,333, or 14% of the adult population. Dr. Anthony, who also spoke on the occasion of World Non-Tobacco Day 2021 observed on Monday, stressed that smoking while positive with COVID-19 is a detriment.
So if you have someone who is a smoker, smoking a cigarette, and they're positive, they can also, when they cough or sneeze, transmit that viral infection, and that can spread to persons who are around. So it is one possibility that with smokers, if you're around them and they're positive, that you can easily get transmission.
Temika Rodney reporting for the HGP Nightly News.